Everybody's health insurance costs are going up. And especially if you're over the age of 50, you need to see this. I'm going to have some solutions for you guys, but let's get into it.
All right, according to a new report from the Financial Times, Americans are facing their biggest increase in health insurance costs in 15 years. And I think this issue highlights the dichotomy, right, the juxtaposition between the two parties. The Republican Party's health care plan, as Donald Trump said during the debate, he has concepts of the health care plan. Well, they're kicking 17 million people off of Medicaid. They honestly, were it not for John McCain, repealed Obamacare, but they have no plan to replace Obamacare. They have no plan for health care other than to let people just continue to pay and pay and pay.
So just so you know, for Medicaid, a lot of people are losing it. To get Medicaid, you've got to have an income for a household of one under 21,000, and every additional household member you have adds like 2 or 3K of income max. Medicaid is free insurance for ultra low income. And when we're talking about Obamacare, that's the same thing as Public Marketplace or Affordable Care Act ACA plans. What that means is you're going to get a subsidy on those plans based on your income, but they're reducing the subsidies because they're not having the COVID enhanced subsidies. Those are going away.
So the Republican plan is to do nothing while your costs go up. And in fact, to do worse than nothing, they're kicking 17 million people off of their health care. While the Democrats are the party of Obamacare and the Affordable Care Act, mind you, Obamacare is so popular, Republicans have stopped calling it Obamacare and they finally call it the Affordable Care Act. And Democrats are trapped in a debate over whether we continue to expand the Affordable Care Act, when we go towards a public option where everyone can buy into healthcare as an option, or whether we go to a Medicare for all system where we replace private insurance with government healthcare. But Democrats are debating how to give people healthcare.
Now, when he says private insurance, what that means are plans that don't care about your income. They give you reduced rates based on your health history. It's kind of like the old school plans before the ACA was a thing. So the healthier you are, the lower rates you get. Now, the solution that I've found is a website called HealthNerd.net. HealthNerd.net. They're going to give you all of the options you've got. You're going to get your quotes. And the cool thing is no one's going to call you. You put your info on any other website, they're going to not give you quotes. And you're going to get a bunch of calls, texts, and emails. So with HealthNerd.net, you don't get any of that. You just get all the info you need, and that's it. Let's keep going here.
You know what annoys me? You know what really grinds my gears? Health insurance. More like wealth extraction. Can someone explain to me how I pay hundreds of dollars every month for health insurance and then still owe money when I actually try to use it? Like, what I'm paying for? Moral support or vibe of being covered? Because it's starting to feel like a very expensive safety blanket with lots of holes.
So the reason why this guy's paying so much on his health insurance is he's probably got an employer coverage and has a family on it, has more money obviously, or he's getting an Obamacare plan. But the reason why his expenses when he uses it are high is because of deductibles. So when you have a deductible on your health insurance plan, it's typically going to be high, $5,000, $8,000, whatever. What that means is your insurance plan will give you something like a copay to see your doctors, usually like $30, but anything else, lab work, emergency, procedure, imaging, whatever, you have to pay into that deductible of whatever it is, $5,000, $8,000, and until you meet that, your insurance isn't going to cover much, if any of it.
Your visit will be $35 with insurance. With insurance? Yeah, without insurance, it's going to be $2,000 and a blood sample from a firstborn. Yeah, oh yeah, don't even try to understand the explanation of benefits. That document is just one huge fever dream. And the real kicker is that half of the time, your doctor is not even a network. You find out after appointment. Well, it's like a plot twist.
That's another thing too. They're not going to tell you if you're a network or not because they don't care. They're going to bill you anyway. So do your due diligence. Whatever your insurance plan is, Aetna HMO, United Healthcare HMO, Blue Cross PPO, whatever, make sure that doctor takes your exact network so you don't get a surprise bill. But just so you know, there's networks, right? There's HMOs, they're the most common, HMO and PPO. HMOs are the ones that you're going to have mostly in network doctors in your county, and nothing else is going to be a network. Whereas with a PPO, you're going to have coverage typically nationwide and just about everyone will accept it. The difference is if you go on Obamacare and get a PPO, it's super expensive. So the only affordable way to get a PPO is through the private networks. And again, you can only get those if you're pretty healthy. And I'll kind of tell you more about that later.
Our health insurance deductible is $8,000. And I know that sounds like a lot, but our out-of-pocket max is also $8,000. And this is for me, my husband, and my kids. My job offers 3 main plans. So I either have an option of $8,000, $3,500, or $1,800. My mindset towards health insurance is typically once you reach your deductible, you still have more to pay anyway, except for with this plan I have. And I would rather pay for medical bills in the event that something happens where we have to pay more out of pocket, rather than me having my paycheck have more taken out every 2 weeks.
So if you've got an insurance plan where your deductible is the same as your max out of pocket, you have something called catastrophic insurance, because that insurance plan isn't going to pay for anything other than a doctor's visit where you just get a little bit of a copay until you meet that full max out of pocket. Granted, catastrophic also means, with any insurance, the max out of pocket, once you reach it, once she pays $8,000 in medical bills for a year, then everything else is covered. I do believe she's mistaken, though, that she thinks her family max out of pocket is $8,000. It's typically at least double. So she more than likely has a $16,000 family max out of pocket. Again, you're only going to reach that if the entire family has major health issues. Probably not going to happen. So I get where she's going with this, but she doesn't sound like she has a good option.
Why is America one of the only countries in the world where you get your health insurance from your employer and not the government? Turns out that in World War II, the government put a freeze on wages. Employers couldn't attract good workers because they couldn't change their wages. So they came up with an idea to instead give people health insurance. So as a consequence of that, health insurance became something that employers would give you to try to attract the best employees. And ever since, it's held over to be the standard model in the United States. This is Nelson Rockefeller trying to a system where you can see that private health insurers pay for the vast majority of their insurance. And it comes from you. Those are wages that might have been paid into your pocket to try to retain you as a worker, and instead are coming through the health insurance, which of course makes you very wedded to your job.
So the other thing, employer insurance, it's typically a very good option to take your employer insurance if you're just a household of one, because it's going to be cheap. You're going to be paying maybe $50 every 2 weeks, maybe a little more, I don't know. Where it gets expensive for employer insurance is if you have kids or your wife on there, or the whole family. The reason why this is, the employer is only required to cover at least 50% of your insurance costs, but only for the employee. So you're adding your family onto this employer plan and you're paying full price. If that's you, honestly, the best solution is get yourself private insurance, either for, let the employee have their insurance if it's the man or the woman. And then for your wife and kids, get them private insurance, okay? They're either going to get a reduced rate based on their income, or they're going to get a reduced rate based on their health, respectively, ACA plans or private plans.
I hate to say we told you so, but no, we told you all this would happen. And all you could do was, that's not true. Trump said they won't cut Medicare and Medicaid, but no tax on tips and no tax on overtime. You're just mad because Trump keeps winning. Wins upon wins upon wins. Does this look like winning to you? Because to me it looks like we're all fucking losing. So what will this look like for people under the Affordable Care Act? It's gonna look like a double-digit increase in premiums. And I'm not talking about, double digits, is that $10? No, I'm talking about 18%. Do I have your attention yet? And on top of that, did you know there's a lot of government subsidies that go towards helping people pay for their insurance? Yeah, a lot of people were using those, and now those are going away. The healthcare tax credits, they're letting those expire. Oh, but don't worry, the Trump tax cuts from his first term for the wealthy and the corporations, those got extended permanently. The subsidies and the tax credits will take effect immediately. The increased insurance premiums will follow soon after that. The actual Medicaid funding cuts won't take effect until next year.
All right, so where you're going to start seeing your increased rates depends on when your plan renews. That's probably for you going to be November, December, and definitely by January. Okay. If you have health insurance and you're on an ACA Obamacare plan, you need to go to HealthNerd.net. Okay. They let you set up an appointment and get a consult and see where you're going to save money, because your insurance for 75% of Americans, like it said, is going up a minimum of 18%. And you probably don't even have good insurance. Okay. You probably never even heard of private insurance anyway that's based on your health. That's a common one that a lot of people can get. You don't have to be super healthy. You don't have to be an Olympian. You just can't have it like a scheduled surgery. Most of them will let you on them. Typically, you get a PPO and actually good benefits too, and it's going to be less cost than Obamacare unless you're really low income. So check it out, healthnerd.net.